live streams and recorded. I'm excited to get to the second year. So we'll recap our mission over the next 8 months is both urgent and achievable. Working with the Behavioral Health Talent Assessment commissioned by the Oregon Higher Education Coordinating Commission, so it's the HEC. We're going to develop an action plan by January 2026, January 31st, 2026. Plan is to go again. The plan will address workforce shortages and the loss of experienced professionals. It will seek to increase workforce diversity, cultural competency, and improve the outcomes of providers serving vulnerable populations. To do this, we need to be honest about the challenges we face while encouraging people to join and stay in the behavioral health field, which we know is both rewarding and meaningful. We also must keep in mind that we are building the workforce of tomorrow, not of yesterday. And addressing this workforce crisis will require a new way of doing things, which is why you're all here. The meeting today is focused on how we're going to do our work together to achieve the goal of the action plan. And so after this meeting, we're going to establish the subcommittees. So we're going to spend a big chunk of time today going over what they are, and then we're going to ask for your feedback about which ones you want to be on. And then we'll give you a link for that. So then after that, Julie Ibrahim will go through council agreements. We did not do those, but we should do them. And for folks who've been doing this work for a while, that just seems like it seems like we can't have a meeting without these shared agreements. So we'll take a minute to establish those. Afterwards, I'll give a little bit of an overview of the subcommittee. They will be tasked with digging into the HEC recommendations, and we've talked about this in the past. This is a great council and it's large, and so the meat of the matter needs to happen in the subcommittees, and they will bring it back to the full group. The subcommittees will be tasked with doing it, and just know that there will be staff support to prioritize and then start developing the action plan. Then I'm going to turn it over to Taylor Smiley, who will do a deeper dive into the deliverables, the topics, the talent assessment recommendations, and the next steps. I do want to just remind people that this has been done before. And Taylor has worked in a similar capacity. So while this may seem daunting, know that this is not the first draft, and that Taylor has his first rodeo, and so you have experience working through these kinds of things. She's got your back. Lastly, Sarah Foster, Workforce, Labor, and Higher Education Advisor with the Governor's Office, is going to do an overview of the draft prioritization framework. We'll have some discussion about that today, and then we'll do some feedback, and then we'll adopt it at the next meeting. So just know we'll start the conversation. If there's additional information you want to share, you'll want to think about it a little bit. That's what the plan is. I mean, we don't have to make this decision. I also want to let people know that Eric Martin is subbing for Van Burnham today. Did I say that right? Okay, perfect. And then if you have questions as we go, feel free to put them in the question and answer feature on the Zoom. Raise your hand. And then the invitation email you received from Chad Albright should have his email and his phone number. If you call him if we hit if there's any technical issues. Lastly, and I will model this in one moment, is to mute yourself to reduce background noise. We're going to take the next 10 minutes or so to work on council agreements. And Julie, would you please take it away?
So Julie, I'll share screen and then we'll turn it over to you for group agreements.
Okay, great. Thank you.
All right. Let me know if you can see the presentation.
Perfect.
All right. And I'll switch the display real quick.
Okay. Thank you very much, Taylor. For those of you that don't know me, my name is Julie Ibrahim, and I'm the CEO for New Narrative. We're a nonprofit mental health agency. I'm also one of the vice chairs for the recruitment and retention subcommittee. So I'm just going to briefly go over the group agreements, rules of engagement, if you will. I know all of you have worked with group agreements before in various settings. So we've got 7 we're going to go through. The first one is honor the lived experience of our behavioral health workforce and use asset-based language or strength-based, if you will. This is the first one because we are here to support our current workforce and to dream of what that workforce is going to be. This is all about our workforce. And so this is why we're starting with this particular group agreement. The second one is everyone is encouraged to participate, but is not required to. Now, you may be asked to share what you think, or we may ask for comments from those who haven't spoken, but it's okay to pass when you are asked to share a comment. We need to honor that everyone processes information at their own pace and in their own way. So it's okay if you don't want to comment at the time. And you can also put comments in the chat if you don't feel comfortable on camera. The third one is self-reflect on your participation. We don't want 1 or 2 people to necessarily dominate the conversation all the time. We want to hear from everyone. If you've already voiced your ideas, let others have an opportunity. And when you speak, try to be brief. We've got a lot to do in a short amount of time. I tell my team all the time, be brief and don't tell stories. Number 4 is listen to understand and respect other people's points of view. Repeat back what other people have said to model listening, to seek to understand, and to ask questions for clarity. If you're one of the therapists in the group, you will be very familiar with this technique. Number 5, do your best to understand the pros and cons of every option, not just those you prefer. Be open to changing your mind on something while also leaning into your expertise. The 6th one is engage in active listening. Ask questions to seek clarification when you don't understand the meaning of someone's comments. It's always okay to ask questions. And then finally, practice generative conflict. Conflict is okay, and it can be really good. We want to use conflict to generate new ideas for the group and to improve understanding and outcomes. Are there any questions, or do we think that we've missed anything? Okay. Thank you.
We talked about how that would probably go fast. Can folks hear me okay? Okay, yay. Sorry about that. We were fixing a little bit of the audio. Okay. So we're going to spend a big chunk for the next while talking about this subcommittee. I'm excited to talk about that. We've kind of all been getting ready for the council subcommittee discussion, and this is where the details of the proposed action plan will be developed. There'll be 3 subcommittees that the recommendations will be assigned to. And you've seen this in the materials. The Education and Training Pathways Subcommittee, which will be chaired by Robin Samping. The Licensing and Credentialing Subcommittee, which will be chaired by Eli Kinsley, and the Recruitment and Retention Subcommittee that will be chaired by Julie Ibrahim. So after this meeting, we're going to go through what the committees do. And then after this meeting, you're going to get a survey from staff asking you to indicate what subcommittee you're interested in being on. We're going to do our best to align folks, but we also need to spread the expertise through the committees. And there's been lots of discussion if you have everybody of one type in this committee. And so we're going to work some magic and try to respect people's choices. Also, just spreading the wealth, and then we'll be getting back to folks. Primary deliverable is to build the action plan around the HEC recommendations. And I want to be clear about this. The strategic guidance that from you all is essential to making this work. This is, and HEC said this in their report. We needed to get more feedback from folks from different areas of the practice, and that is what we're here to do. I also recognize you are incredibly busy. You have full-time life, and so staff is always going to prepare a first draft for feedback. That's what it is. It's a first draft, and then there'll be an opportunity for your feedback, and then there'll be another draft. So just know as staff walk through the specifics of the subcommittees that there will be support for this process. And with that, I wanted to turn it over to Taylor, who is going to walk through the subcommittee deliverables, the timelines, and the next step.
Wonderful. Thank you, First Lady. So I'll go ahead and share screen, and I welcome questions throughout the presentation. So if folks have questions, concerns, or something doesn't make sense, please feel free to stop me. I won't be able to see your hand if it's raised, so no worries if you just want to go ahead and unmic. Can folks see my screen all right and hear me okay? Great. Okay. So what we're going to walk through over the next few minutes, and then want to spend a good amount of time hearing from you all, particularly about the assignments for the talent assessment recommendations. But we will talk about what are the subcommittees. The First Lady mentioned it, but we'll go over it again. What will the subcommittees do? So what are the core deliverables? What support will they have? We want to make sure that you all understand the staff support that's available through this process, because like the First Lady said, this is achievable. It's a big lift, but absolutely achievable, and you will have a lot of support. And then what is the timeline for the subcommittees as it relates to the timeline for the full council? And then finally, what are the talent assessment recommendation assignments? And these are preliminary. So this is the first round of assigning all of the HEC talent assessment recommendations to specific subcommittees. So after this portion or during it, would love to get folks' feedback if you feel like there are any assignments that you think should be somewhere else in general. So any questions about the overview before we move into it? Okay. So as the First Lady just said, the three subcommittees are the Educational and Training Pathways Subcommittee, chaired by Robin, Licensing and Credentialing, chaired by Eli, and Recruitment and Retention, chaired by Julie. And what will they do? So 4 major things. The first 3 things will happen first in the months of July. So the subcommittees, once they get their assignments of the HEC talent assessment recommendations, will work to prioritize them. And we will talk about the prioritization framework later in the agenda, but that's the framework that subcommittees are going to use to take all of the recommendations that you have been assigned and to prioritize them, which is really in order of what you're starting with first and what you're ending with. So it's really how to prioritize your workflow. And we'll talk more about that down the road. And then the next 2 sort of work products, if you will, are really opportunities to expand the subcommittee to ensure that you are including all the expertise that is needed to inform your work. So to identify subject matter experts, so staff will work on a recommendation for you all about subject matter experts that are really connected to the recommendations that you will be working on. You're welcome to recommend subject matter experts, but these are folks who can be more engaged in the process and listen in on subcommittee meetings. They won't necessarily be members of the subcommittee because the subcommittee, we want to just keep it a manageable size, but folks who are able to listen in and then after meetings provide additional feedback through the email address that the council has, where the general public is able to reach out and give you all feedback as you're doing your work. So we just want to make sure that your work is accessible to folks, and this is one of the ways that it can be accessible. And then next is developing a stakeholder engagement plan. So this I would think of as, who are you going to actively seek their feedback? Subject matter experts may be coming to you to share feedback, but who are the stakeholders you really need to hear from, who might not have the time or capacity, frankly, to be able to listen in on subcommittee meetings, but have really valuable perspectives and expertise to inform your work. So similarly, staff will be developing a draft for your feedback and consideration, but during your work, these are the stakeholders that you would be reaching out to, and the recommendation will also include how you would be doing that outreach. Is it a survey? Is it listening sessions? So this will be part of the first couple of weeks of the subcommittee's work together. And then last, and most importantly, and the most amount of time that you'll be spending together will be focused on this set of deliverables but you'll be developing a plan to advance each of the recommendations you have been assigned. And the plans are really the building blocks of the full council action plan. So as you develop a plan and agree on it, you'll share that up to the full council for consideration. Once the council adopts those sort of mini plans, if you will, that's what builds the bigger plan. So I'm going to pause here and see if folks have questions before we move forward. Great. All right. And if there are questions in the chat too, feel free to unmic and share them. So next is, what support will they have? You will have a lot of support of a team of folks who are very passionate about this and are committed to making sure that this group and you are successful. So the governor's office and agency staff will work to support each subcommittee. So they will manage all of the subcommittee logistics, like scheduling. They will draft initial deliverables for your feedback. So you don't have to worry about putting pen to paper and drafting things. They'll share something for your feedback, and then they'll incorporate your feedback and edits and give you a revised version to look at. They will also help to be your task masters and manage workflow. So they will be helping to inform you all and working with your chair about how much time you have left, how many action plans you need to complete by that time, and managing basically the pace of your meeting so that you all can make sure that you are developing wonderful action plans, but also meeting the overall timeline for the council. And then lastly, if there's additional material that you need to do your work, like questions that you have, reports, subject matter expert presentations, they will hear from you about what it is that you need to inform your work, and then either develop additional or supplemental materials, arrange for presentations from subject matter experts to come and support the conversation. Any questions about support before we move on? Great. Okay. I love this timeline. But here is a timeline of the work for the subcommittees and how it connects to the overall work of the full council. So the blue is the full council and the yellow are the subcommittees. So right now for the full council, we're in sort of the organization phase, establishing the subcommittees, assigning recommendations to them. So that's the work that we're doing now. And then subcommittees will meet and do their organization. So this includes prioritizing your recommendations, figuring out how often you're going to meet, how often you need to meet to work through your recommendations. So we're in organizational mode for both the full council and the subcommittees until about mid-July. And then we have the subcommittees really move into drafting the action plans. And so this will be from July until December. And then as you all, as I mentioned earlier, develop your action plans to advance the individual recommendations, you'll lift them up to the full council for feedback, consideration, and decisions. So that's why there's a little gap here at the end. So ideally, subcommittees would be shutting down, if you will, and having lifted up all of their recommended plans. And then the full council can continue working through all of them so that we have the month of January to compile everything and format it very beautifully for a final report. Questions about timeline? Or concerns?
This is Bethany. Can I ask a question?
Yeah, absolutely.
So with the blue and the gold, does that mean they'll, am I interpreting it right? There'll be additional meetings, so there'll be like the council or this group is continuing to meet, and then we'll have sub meetings also.
Correct. And currently the council meetings are scheduled for twice a month. But at this early stage, for example, if subcommittees are really active, you all might want to give feedback to your subcommittee chairs that maybe the full council could slow down meetings for the months where you're really active in action plan development. So we can space out the council meetings so they're responsive to the workflow coming from the subcommittee. So I would say it's flexible, but the intention is that subcommittees really get into their work, and then council meetings are happening when there's a full slate for review.
Thank you.
Any other questions? Okay. All right. So moving next to the preliminary assignments. So I'm going to share screen on that attachment that you all received that is not as beautiful as the PowerPoint presentation. It is a table, but it is the easiest way, I think, to walk through the information. So what I'll say before I switch to that is that you will notice that some recommendations have only been assigned to one committee, that some recommendations have been assigned to two. So this is really intended to indicate that a recommendation requires the expertise of multiple committees and that there will need to be collaboration between those two committees to build out an action plan for that particular recommendation. And then some recommendations have been assigned to all three committees because it's work that all three committees are expected to do. So for example, there are some recommendations related to equity that is an expectation for all subcommittees. Any questions about that before I switch over to this beautiful but somewhat complex table? All right. And as I go through this, feel free to give feedback as I walk through it. Can y'all see this, even though it's tiny?
Yeah, can I jump in here really quick?
Oh, yes, please.
So these are this is all of the recommendations from the talent assessment, put it in a table. And then we had multiple, like, we did a draft, what the vice chair to think about where these things. Which is gonna, there's a lot of, and as Taylor said, some things were very clear, some things crossed over. But then, and so this is the first pass through. There's no expectation this is perfect as is, but it's a really good start. Just doing this with everything together, if you think it's a long spreadsheet. But this is kind of this is the starting point. But I do want to, it's important to spend some time here because this is the bulk of the work. And so we're looking at the recommendations, making sure that it makes sense where they are. Again, maybe there's a lot of conversations today, so we'll do that. So we want to put that out there before we get there. And thank you to everybody for good work on it.
Thank you, First Lady. And so I'm going to zoom in on the first part, but just know that this is in your packet. So if you want to follow along, and it also includes the page number and the HEC talent assessment for cross-reference for folks who have that by their side at all times. All right. So starting with the first one, this is academic pathway efficacy. So evaluating the efficacy of academic pathways leading to employment in the behavioral health sector. So this is really about conducting further investigations into successful practices and outcomes based on educational data tables that are in the report to determine and help inform initiatives to bolster enrollment, career guidance, and entry into the behavioral health sector. So this one is assigned to educational and training pathways. Any thoughts or feedback about that one? Okay, low-hanging fruit to start. The next one is craft a set of statewide initiatives to provide early career exploration, appropriate work-based learning experiences, and career guidance based on individual interests. And that one has been assigned to both recruitment and retention as sort of the lead subcommittee with support from educational and training pathways. Great. Going next to marketing campaign. So this is to design and disseminate a marketing campaign for a broad audience of stakeholders, from high school students to legislators, that answer a set of basic questions. What is behavioral health? What skills are needed or preferred? And what is the scope of roles from entry-level direct service to management? This has been primarily assigned to educational and training pathways with support from the recruitment and retention subcommittee. Moving on, we have career guidance. So to establish and disseminate best practices in behavioral health career guidance to better assess, inform, and encourage job fit. So this is assigned to educational and training pathways. Next, we have high school curriculum development. So this is to define and pilot high school curriculum units that reflect authentic rewards and challenges and providing behavioral health care services. So this was assigned to educational and training pathways. Career experiences, also education and training pathways to identify and pilot viable early behavioral health career experiences, such as partnering with social service agencies. Any feedback about those? Great. Okay, next is licensing and credentialing. So this is to promote behavioral health technician roles as a pathway for younger demographics into the behavioral health workforce. It's a position that pays well and serves as an entry point and does not require lived experience. Then next, we've got another educational and training pathways and recruitment and retention duo. So this is to focus on increasing access to financial support for behavioral health related educational programs to address faculty shortages and regional gaps in access.
Taylor,
Yes.
on 2E, and maybe because I was just going to mention it might be helpful to put for supporting educational and training pathways because a lot of times educational institutions are part of that licensing and credentialing process, either in getting requirements or sometimes we house the pathways for those.
Great, thank you. Make a note of that
I'm
one.
not trying to put myself on that committee, but someone working in education, they're helpful.
Should I have mentioned that if you, any comments and you have to lead that recommendation? I'm just kidding. But thank you. I have that one noted. Any other feedback on that before we move on?
Well, Taylor, I just want to jump in as you're going through this. It seems like a lot of these where there's education and training pathways and also recruitment and retention. Seems like there's a lot of crossover. And if I wonder if you could clarify the focus of the two different ones and so that we can figure out, like, just be clear on where it makes sense for one to take the lead versus the other.
Yes, and First Lady, I would throw that to you first.
Well, so for some of these, good question. What we're trying to do is that, as we've talked about before, there's a gap sometimes between, what's happening in education and what's happening in field. And so some of this is to try to, bring both of those together and, to kind of thread those through. And so, some of this stuff, for example, is happening kind of on a campus setting versus someone having in a clinic setting. And so that's what we're trying to address there. And then the other thing we're trying to do is also balance up the number of recommendations and where they go, which are that kind of the two pieces.
And I have nothing to add. That was perfect.
Yeah, thank you. That's helpful.
Yes, Julie.
I think we also talked about on these dual action plans that the lead would develop the recommendation and then we may have some joint meetings with the other group to just make sure that we're aligned on the proposal.
Thanks, Julie. All right. Thank you so much for the feedback. So next we're moving to the threes, moving right along. Increase access to educational programs. So this is increasing access to, oh no, we already talked about that one, apologies. Next is the creating pipelines for behavioral health faculty with salaries that supports the cost of living. So this one is educational and training pathways. Next is degrees offered. So this is increasing behavioral health degrees that are offered and slots within those programs. So solidly educational and training pathways for this one. Same with transferable credits. So bolstering associative arts organ transfer and associative science organ transfer degree pathways. So that's with ed and training. And then we get into alternate pathways, which is licensing and credentialing leading and educational and training pathways supporting. And this is communicating how associative applied science degrees from behavioral health workforce and allied professional career and technical education programs and community colleges are a viable pathway. And First Lady, I don't know if you want to jump in on this one because I know there was some discussion here.
Well, and there's also some of these, and some of them that are not necessarily, that are CTE that may not require community college. Where there's also credentialing whether they can require an education path. So that will be handled at the licensing and credentialing level, and then the pathway for evidence training for them is the overlap. But not everybody is going into this practice through an educational, through an education.
Thank you. All right, and Julie, I see your hand.
I was just going to comment on the discussion we had on this one too. We had talked about licensing and credentialing, kind of creating the master map of different career pathways, and then that be handed off to educational and training in terms of, okay, how would this master map be communicated to students coming into the field?
Great. Thank you so much. All right, next moving to community college outcomes. So this is investigating further the trend that the report touched on of the declining number of students entering the behavioral health field from community colleges. So this is educational and training pathways. Next is mobile positions. So analyzing which credentials offer limited career mobility and which provide broader opportunities to better inform investments intended to bolster the workforce. And this is with licensing and credentialing. Next, we have education and training program funding. So recognizing that state funding for educational and training programs needs to come with a 5 to 6 year timeline. So programming can be fully developed and sustainable, since accreditation for programs can take up to 3 years. So this is with education and training pathways. Great. And then we move into a set that has both. So recruitment and retention and educational and training pathways, starting with lowering the cost of education to increase access, especially for community college and public universities. So this has recruitment and retention as the lead here. And First Lady, feel free to correct me on this, but I believe the intention is to really focus on supporting folks that are in the community mental health field currently and are doing that work. So that's why it has recruitment and retention as the primary. Is that right, First Lady?
Yes, so this is scholarships, loan repayment over lowering the cost of education in general.
Great. Thank you. And then we've got financial aid. So similarly with recruitment and retention as the lead. So supporting financial aid scholarships, tuition reimbursement, and loan forgiveness programs with a focus on folks that are doing community mental health work. And then we have exploring alternative options to cumbersome and confusing loan forgiveness programs with recruitment and retention as lead there, with education and training as support.
Oh,
Julie.
and that actually, can I jump in here?
Yeah.
This was one of the things that I think is challenging here that I've heard about, and I would ask for feedback, is that often when people are navigating this, they are in the workforce as opposed to outside of the education pathway. And so that's where I know it was the most challenging for folks in the clinic, is it's like they're trying to do it, but they're not connected to an institution anymore. And so it was more often that was going to be, is it more appropriate to put this with recruitment and retention so we can work with the employers? And then I should have mentioned, that is also kind of a way of thinking of like on campus versus in workforce, which is, kind of where people are physically at, so we can get the supports to them.
And this one's a popular one for discussion, which is great. So I'll start with Julia and then Liz and then Bethany.
Thanks, Taylor and First Lady. That was really helpful for my thinking about this. I do wonder if maybe these should really live in both as leads, and one focuses on folks in the workforce and one focuses on up and coming, people looking to enter the workforce, because I do think that education and training institutions and my agency, the Higher Education Coordinating Commission, have a lot to do with the financial aid scholarship piece, and should probably be on the lead for some of that.
Thanks for the recommendation, Julia. Liz.
Hi, thank you. I agree with what Julia was saying. What I was gonna add was, this is a common thing that's talked about in the workplace, is that this is like some of the applications are really difficult. Some of them are difficult to get approved for, and it is difficult. It's part of retention for sure. I think it's something that attracts people to the jobs, and it's something when they're not able to get it that makes it difficult for people to stay.
Thanks so much, Liz. It's a great point. Bethany.
Hello, also agree with everything that's been said, and similar to earlier, I think just remembering or working together, because someone could be in the workforce and then the pathway could be then going into some of those educational to get the further training or to get certificates or go. So while it might support students currently, it might also be supporting a way to support future or further education development. So I agree with the both, and I apologize, I don't remember who spoke first, but yeah, maybe that idea of taking different parts or working together, because I think both are true. Like both areas really are important. Some will be those going into the workforce, but once someone is in the workforce and needs retention, they might be coming back for those educational or training pathways.
Wonderful. Thank you so much. And Liz, I see your hand up. Is that leftover or new? Oh, great.
It was leftover, sorry.
No worries at all. Awesome. Thank you all for the feedback. Anything else on these three before moving on? Okay, wonderful. Oh, First Lady.
Okay, wait, I do have one. And I think, the other thing I think we discussed is that education can, we're also thinking about education can sometimes be for continuing education that may not happen in an academic setting. right? So funding for additional, funding some of the things, potentially looking at the cost of things that are to get into the workforce, whether it's licensing, credentialing, other types of certifications, would also be considered in the cost of education.
Awesome. Wonderful. Okay, moving us to micro credentials, providing funding for micro credentials. So this is licensing and credentialing. Next is creating clear language to define behavioral health and manage publicly accessible resources to help guide and support those entering and working within the behavioral health field. So this is with educational and training pathways. Any feedback here? Okay, not seeing hands. Moving next to, again, clear language. So convening a work group of stakeholders to create the clear language around behavioral health to foster more cohesive and consistent vocabulary and structure, educational and training pathways. Next, we go to career pathway mapping, which I think HEC has already started working on to support this conversation, but creating information for career pathways that outline the clear steps to obtain various behavioral health careers that are informed by professionals' experience, to offer comprehensive, publicly accessible career and credentialing information with no fee, membership, or registration required. So this is Educational and Training Pathway Subcommittee. And then next we have a whole bunch for licensing and credentialing. So the meta recommendation here is streamlining and standardizing licensure process and requirements. So that has licensing and credentialing leading. And same thing with all of the specific recommendations that kind of fall under that umbrella recommendation. So researching best practices from other states, working to create a crosswalk of behavioral health credential and licensure requirements in standard coursework in relevant fields, and exploring national initiatives such as the National Center for Interstate Compacts and the Social Work Licensure Compact as examples. So those are all with licensing and credentialing. Any thoughts here? Great. Okay. Next, we have Grow Your Own. So offering region-specific behavioral health career roadmaps to encourage a grow your own approach for tribal, rural, and frontier communities. This is with recruitment and retention because so much of this work is currently happening. Providers are leading in this space. So that's why the recruitment and retention subcommittee is leading here. All right. Moving on, we've got transparency about licensure requirements. So this has educational and training pathways as the lead with licensure and credentialing in support. And this is to be transparent about the time commitment and cost to get licensure or further degree so that students understand the full breadth of the requirements while they're getting their education. Any comments about this and/or questions or feedback? All right.
I have one to jump in real quick. On that one, I'm wondering if we can just expand it a little bit for the educational component. We're seeing a lot of people who get degrees that they believe qualify them for things that they're not really qualified for. And if that transparency could also be regarding, whether or not a degree path is eligible for anything as far as credentials go. I think that would be helpful.
Thank you, Summer. Okay, making a note there. Anything else on this one? Okay. So next we've got defining and support and expanding support for educational pathways from high school and across all post-secondary options. So that's education and training pathways. Next is pre-med tangential pathway. So creating a curriculum akin to pre-med for behavioral health careers that has a recognized value and applying to the next level of education. So this is educational and training pathways. Next, we have community college funding is with educational and training pathways, but this is supporting expanding community colleges as a step to a bachelor's and beyond. Next, we have incentivizing collaboration with community colleges to facilitate a viable career pathway. This is with educational and training pathways. And And the next, completion rates. So work within the bachelor's and graduate degree programs to support behavioral health pathways to raise completion rates. And that's with educational training pathways. Any feedback there before we get really deep into recruitment and retention? Okay, and we're halfway done. So thank you all so much for sticking with this and for providing the great feedback as we go. Really is super helpful. So next is compensation, just a small conversation to address inequities between community-based and private practice providers. So this is within the recruitment and retention subcommittee. Next is progressive reimbursement rates, also with recruitment and retention, to develop progressive reimbursement rates and billable services, which currently undervalue community-based healthcare as well as client needs and outcomes and fail to support culturally responsive care. Next is exploring and funding financial incentives for specialized workforce roles. So if, for example, a position or job, region, or focusing on underserved communities that align with union regulations and are equitable. So this is with recruitment and retention. All right, continuing with recruitment and retention, we have redefined and provide the resources to community mental health work as a sustainable career choice rather than a stepping stone to private practice. The next two are a combo between recruitment and retention and educational and training pathways, with recruitment and retention leading. And this is expanding funding and resources for education and professional development, and expanding tuition reimbursement programs, subsidizing training opportunities and certification costs. I'm curious if, based on the feedback above, Julia and Liz and Bethany, that you provided, if you would have the same feedback for these recommendations as well, just because they seem similar. Just want to pause, make space for that.
Yeah, I think I do have that same feedback, Taylor.
Thanks, Julia. Liz?
Agree. Yeah.
Awesome. Great. Anyone else have thoughts about these ones? All right. So next we have increasing access, so subsidizing housing, relocation, childcare costs, particularly in rural areas and within underserved communities. So that is recruitment and retention is lead. Supporting workers and supervisors. This is establishing best practices for supporting workers and supervisors is with recruitment and retention. And then next is subsidizing clinical supervision, also with recruitment and retention. Bethany.
Yeah, I just want, and I don't know if it would be here somewhere else. I was kind of waiting for this one because we have two different areas of subsidized supervision. So there's clinical, which usually means the student is, or the person has graduated and now is getting it. And then we have educational, which is during that practicum time. So I'm going to call those out because especially in my experience, the practicum supervisors who actually have more responsibility than a clinical supervisor in terms of or time commitment of oversight, aren't always considered. So just making sure that we're being clear about clinical and practicum supervision.
For 7C here, the subsidizing clinical
Yeah,
supervision.
unless it's covered somewhere else, but because that is one, yeah.
Okay, thank you for that feedback. And I think, Eric, you might have had your hand up, but I don't think I can see it. So I would go to, sorry about that. I will go to Eric next, and then Robin, I see your hand.
Back on the education and training, I don't think I saw anything in there about some sort of vocational training path. It all seems to be very academic based as opposed to any sort of vocational training. So, out of our 17,000 certified members, 18% of the mental health workers have no college degree. And on the SUD side, about 40% have no college degree. And a disproportionate number of those folks are peers. And so, when we're talking about recruiting people, that don't have a college degree, they already work in the field. We don't have to go out to some high school or trek out somewhere to find people that are interested in getting a degree and don't have a degree. We have thousands of those people that already work in behavioral health. So it would be nice to see if there was a vocational pathway and then also some sort of recruitment from within our own ranks. And ASFME put together a great program where they have incredibly inexpensive college education. I think it's through Illinois, and it's online where all of the members that are in the ASFME Behavioral Health Union, they can get an associate's degree at no cost. At at no cost.
Wow. Thank you, Eric. I really appreciate that feedback. And that's for all of the education recommendations, is just a recommendation for them to also be focused on non-higher ed pathways to support folks that are currently in the field. Thank you. And you said much more that I simplified to that, but thank you so much for all of that feedback. Robin, and then Liz.
Yeah, I just want to come back to the subsidized clinical supervision. Because of what was just said, I do think that the educational and training pathways should be secondary for that, because that is something that institutions are trying to figure out how to attend to, as it's becoming harder and harder to have students get the supervision they need. So I would recommend that both subcommittees are part of that conversation.
Thank you, Robin. Liz.
I just wanted to kind of speak to the union side of that because of being a steward with that union. We do offer also, there's through United We Heal, there's also opportunities for master's programs now. But I also wanted to echo what you were saying about people in the workforce. I think that that could be our strongest recruitment and our strongest way to address this is people who are already getting the experience. How can we get them to move up in the workforce?
Thank you so much, Liz. I appreciate that. I also feel like I'm taking notes about subject matter experts that y'all are bringing up relevant to these recommendations. So thank you so much for that. Anything else on I think we left off with subsidizing clinical supervision before we move to the next. Okay. So next we have another for recruitment and retention, which is reviewing and simplifying administrative burdens that are placed on behavioral health providers and supervisors to strike a balance between ensuring high quality patient care without overburdening providers. So recruitment and retention there.
Can I ask a quick question, Taylor?
Yeah.
Does this council have plans or guidance around how this group can work with other committees that are already in place who are tackling some of this work specifically? And two come to mind, one being, I think it's 2035, the workforce, OHA legislative committee workforce, and then also the tackling administrative burden group that's been doing this work for several years. So there's just so much out there. So I'm just curious if that's been thought about, or if you all have kind of guidance, or if that's going to be up to the subcommittees to decide how to engage other groups who are also going after this work.
That is a fantastic question, and is absolutely something that we have discussed to ensure that this there isn't like a duplication of efforts, and that there's as great of alignment as possible, especially if there are other groups that are advancing some of the recommendations. So at the subcommittee level, in the draft outreach plan that you all get, there is work happening now to kind of map out what are the other work groups and or tables where some of these conversations are happening, to support thinking through how coordination would function at the subcommittee level. So absolutely. And so the mapping will be there to provide an update to you all. And if there are things that we're missing at that time, I think it'd be good to give that feedback at the subcommittee level. So answer to your question is like, yes, absolutely thinking about it, really wanting to align with work that other groups are doing here and to coordinate well, and staff will help support subcommittee level coordination on these recommendations. Thank you. This is a big one. So it's nice that work is happening, that there's a lot of work happening here. Thanks so much, Shira. Okay, moving on to the funding work-based learning experiences, internships and apprenticeships. That has recruitment and retention as lead and education and training pathways as support. Questions or comments there? Okay, then we have pairing acute clients with appropriately trained providers, and that's recruitment and retention. We're so close. We have 2 pages left of 8. So just to give you a progress update, and then I think have a break coming after this too. So thank you again for sticking with it.
Yeah.
So Then next, we've got reduced staff to client ratios, and that is recruitment and retention. Next is a sort of a broad bucket recommendation that was focused on fostering collaboration across agencies and stakeholders. So this is really assigned to all subcommittees as you all are working through your action plans, thinking through how to foster collaboration within each action plan as opposed to potentially this being its own separate action plan. But First Lady, any comments you'd want to make there? I saw you come off mic. Okay. Great. Next, this is one I think we could check the box on, is centralizing and creating a statewide strategy for collaboration with representative working groups tasked with recommending innovative solutions based on needs from the field. So this one we have is like the full council is helping to do this work. So not assigned to a subcommittee.
Yeah, and there we go. But also that to speak to the other, where other groups are already doing some of that work, somebody just has to be the tracker and collaborator of that work. It just knows who's doing what. And this is the body that can do that. Because there isn't one at this time. And so that's part of that work as well, is to track it all and have it be collaboration.
Thank you, First Lady. Okay, next we've got addressing the administrative burden on care providers and supervisors. So rethinking, revising, and simplifying reporting, billing, and current redundancies and process and protocol. So that's connected to that administrative conversation that Shira just mentioned. So that's recruitment and retention. And then next, continuing to create partnerships between employees and higher education. So that's assigned to the Educational and Training Pathways Subcommittee. And then we get into adding tiered pathway into behavioral health jobs that support education and employment together as one, not separately. So this has licensing and credentialing as leading. And then next, we have funding students in pre-designated areas that are experiencing shortages and pair this with a 2-year working commitment. So that's recruitment and retention. We have infusing principles of equity and inclusion to diversify and expand the talent pipeline. So this is really all subcommittees, all action plans. Each subcommittee, this is probably too in the weeds, but we'll have sort of a template for action plans to kind of help keep them consistent, and infusing principles of equity and inclusion will be part of all of them to help support the work there. And then next, moving to expanding training towards culturally responsive workforce, starting with leadership. So that's recruitment and retention. And yep, I think recruitment and retention. And then next we have DEI barrier busting, again, all subcommittees. So identifying and reducing barriers for BIPOC individuals seeking a career in behavioral health. So all subcommittees assigned there. And then next, professional development. So increasing opportunities for the workforce to learn evidence-based practices. So that's educational and training pathways as lead, recruitment and retention as support. Then we've got creating programming within organizations that have supportive services, mentorship and wraparound support built in for staff. So recruitment and retention. Clarissa.
I just wanted to point out that I think the wording on that within organizations, oftentimes as a psychiatric provider, representing as a psychiatric provider, oftentimes individuals are afraid of going within their organization for mental health support because there's perceived risk of losing their licensure if they admit to, any kind of failings or substance use or anything like that. And so my work with the Organ Wellness Program we've really identified that that's a huge barrier for mental health support. So I just thought that this might be the right place to put that within organizations is not necessarily a limiting factor. We also need to look beyond the organization. And oftentimes that's perceived as safer.
Thank you.
Thank you.
All right. So next we've got focusing on rural and culturally relevant services, education, training pathways, and recruitment and retention. Next, increasing access to in-person and virtual behavioral health resources in rural areas with culturally competent providers is recruitment and retention. Increasing the share of providers who are multilingual and represent populations that are underserved, underrepresented, and under-resourced is all subcommittees. Developing a career pathways that are supported, well compensated, and sustainable to attract and retain a more diverse workforce is all subcommittees. Using data to intentionally inform initiatives focused on increasing workforce diversity is all subcommittees. And then we have some data-specific recommendations that are assigned to licensing and credentialing. So creating a state data center overseen by data methodologists, licensing and credentialing. I think MacBo is probably excited about this, if I could take a guess. And then enhancing iPads and behavioral health data processes and protocols to consistently capture primary, relevant, and current data, licensing and credentialing. Making data readily available for others to access and analyze, licensing and credentialing. And then we've got benchmarking. So funding primary data collection initiative that leverages an annual longitudinal survey to establish benchmarks and assess where legislative and regulatory initiatives are working effectively. So that's licensing and credentialing. Shira.
Make it through.
We made it all the way through, everyone. I think that's very exciting. Yes.
I was waiting to see if I heard anything that sounded similar to this piece, and I don't think that I did. So I just want to highlight this. What I've heard in all the work that I've done around behavioral health, recruitment, development, pipeline retention work is that the public sector feels like when folks complete their graduate programs, they're not necessarily ready to work in community mental health. And so it's tough for a new grad to go work on my mobile crisis team because it's going to scare them, and they don't necessarily have all the prep and all the tools that they need to be working with such an acute population with all the social determinants of health issues that we see. So I was just wanting to suggest that the educator folks in the room like kind of dig into that curriculum development piece so that folks are coming out of school like really ready to hit the ground running. I think that would be greatly helpful.
Thanks, Shira. Okay, that concludes the review of the very long list of recommendations. So First Lady, I will turn it over to you.
Oh, so great. Taylor, thank you so much for that. There's a lot to do, but it's really important for everybody's style of learning. I'm going to hear it out loud, to look at it, and it's the bulk of the work we're organizing. Thank you for your feedback. That is incredibly helpful. And so why don't we are on time? So it seems like a good time to take a break. If we could have folks stay in the Zoom meeting, but turn off their camera and mute, and then we would reconvene after the time. Take a break, make phone call, do what you need to do. And then
Taylor, can I ask you to stay for a second?
I will call you. And First Lady,
Okay,
we'll come fix your
thanks.
mic. Yes.
Yes. Testing.
Testing, testing. Testing, testing.
We hear you loud and clear.
Thanks, Eli. All right, just a note that we'll be coming back and starting soon.
Okay. We do little mic adjustments. Hopefully that's better. Okay. Again, thank you so much, Taylor. That was a lot of work. I just wanted to just take a second to validate, and this is why this council is so important, is the diversity represented here. That when we think about education, that we also have peers and different groups, and so not everything is a degree path, not everything is an education path, and that we have all kinds of workers in this field, and the goal is to grow all of them. And so what I love is I just get to echo it, but we are absolutely thinking about all the different folks in the workforce. And then I wanted to, Shira made a great point that on the One Oregon tour, traveling around the state, talking with clinicians and different providers and different clinics, the acuity of clients today is a challenge and is something that folks struggle with. We can be addressing that potentially in practicum pathways, but similarly, there needs to be a nexus between the workforce and education around preparing people. Because the workforce are the folks that are seeing folks coming in with this with these different types of challenges, and there's also other socioeconomic issues that are layered in. And so just preparing folks for the types of clients. And so I just want to echo that there has to be a nexus between those two. And that has been something that I've heard all over the state. So this was a really great discussion and such helpful and thoughtful feedback. This won't be so I feel like we got, and if you think of something afterwards, you can always email. An idea comes to you, that's perfect. Not everything is gonna be happening in the moment, and it's welcome and appreciated. So next we're gonna go back, and we are gonna go through the prioritization framework. And so we have all of these recommendations that we have just gone over in detail. And the question is, how do we start thinking about prioritizing these, and what are the most important, what are the things to think about? And so the prioritization framework is a tool that's intended to help the subcommittees identify which ones to do first, which ones to do last, and to think about, what have the biggest impact and are the most feasible. So there is a high level draft for your feedback. And so I would like to turn it over to Sarah Foster. She is the Workforce, Labor, and Higher Education Advisor with the Governor's Office. And she's going to walk us through the draft prioritization framework.
Hi, everyone. I am unable to share my screen, so someone's going to fix that for me. But I'm going to, I will say before this, as a former facilitator, I relished in putting this together because I love a good prioritization framework. And I love that we're having the opportunity to be just in conversation and provide feedback on it, because I think having you all bought into how we're prioritizing things is going to be really important. So I'm going to go over this very, briefly, and want to then kick it back to the First Lady, who's going to lead you all in a discussion on the feedback. So when prioritizing recommendations, I thought it would be helpful, and this is no surprise to anyone in the room who's had to go through their own process and decide as an organization or in a group what's most feasible and most impactful. And those are kind of the two categories in which we're going to think about as we prioritize the recommendations that are assigned to your working group. So this is the first task of the subcommittees, is to really take a look at those recommendations recommendations that were assigned to you and use this framework or a version of this framework once we get feedback to prioritize. So as you can see, if you scroll down a little bit, on the left hand is feasibility and on the right is impact. And if we have high impact and high feasibility, we should probably do those things first. On the flip side, if we have low feasibility and low impact, we should probably consider doing those recommendations later. Though high impact, low feasibility, we should probably consider those because we know that impact is really critical. And then holding off on high feasibility but low impact recommendations. Next page. So how do we actually define these? And so for feasibility, I like to think about the degree in which you can implement a recommendation. So here are some bullets that we can think about when defining feasibility. So having resources or a pathway to resources for that recommendation. Expanding an existing effort might be a little more feasible than launching a new effort. Political feasibility is its own term, but really understand. I think this goes along on broad community support. So do we have support for this recommendation? I think the more support we have, the higher the feasibility it is. And then having a solution ready, I'd say within the time frame of the council. So I think that can be built out into more detail, and I have some suggestions, but there's going to be short, medium, and long-term solutions. But also let's think about the impact that we can have as a council within the boundaries of our scope. And then just low barrier. Those are low-hanging fruit recommendations, typically have high feasibility. So then impact, the degree in which a recommendation has the desired impact. And so how might we define that? And I think that for all the subcommittees, some suggestions are that they're data-driven, that they have prior demonstrated success in achieving the desired outcome. And in particular, I know the focus of this group is on the Medicaid population and really thinking about that population as we're prioritizing our recommendations. So we tend to think about things that impact that population as higher impact when we're looking at the framework. And then each subcommittee is going to probably have their own specific criteria for the education and training, since I'm supporting that subcommittee. Put some ideas out there around the likelihood that the community's most vulnerable members, so those that are underrepresented in the workforce, would access and connect to education and career pathways. So really prioritizing that as higher impact in that subcommittee. Streamlining education to career and credential attainment pathways. So those recommendations that are doing that will likely have higher impact. Those that may be creating more complexity in an already complex system might have lower impact. And then expanding acceleration strategies and increasing timely access to credentials and career. And some of those recommendations were really in partnership with the other two. So some of the licensing and recruitment and retention, but thinking about that as a foundational element to impact in the education and training pathway. So some of the other work groups might decide to have a couple other bullets as they prioritize impact, but thought that we could do a cursory exercise on defining them for the education and training group. So then finally, before I kick it to the First Lady for discussion, just really thinking about timeline for implementation. So what is the timeline? I know that we need to think about time as is there a solution ready within the scope, but also getting a little more granular in how long it's going to take to create that impact. I'm not saying we shouldn't do really long-term, especially some of the recommendations in the education and training space, I understand require long-term thought, but just being mindful of that. And then resources required. Is this, what are the fiscals on some of these recommendations, legislative funding, staffing, and engaging the reality of our current context is going to be important as we walk through this. So I will stop and kick it to the First Lady.
Thank you.
Thank you, Sarah. That was great. And I just want to reiterate that part of the working on some of the things that when they're outside of our control is they're always outside of our control without a plan. And so creating a dynamic where we have to have the plan to fund. And so I know that we've been talking about what cuts could look like at the federal level, and that's always in that's always in the room. But we have to create the best plan, and then we'll figure out what we have to work with. But just wanted to put that out there. And then so we have let's see, we have a few minutes to talk through kind of when we think about the prioritization framework. We had talked about we're going to present it at this meeting. We'll adopt it at next meeting. But I wanted to throw out a couple of questions for folks to think about, and we could take a little bit of time today. I do want to end on time for folks. One way to think about, we could be starting with the recommendations that have a legislative and budget impact. So they could be ready for the next legislative session in February. Just that's an external timeline people may want to think about. People could be thinking about, does it make sense to start with recommendations that are the easiest to implement, that are likely to have the biggest impact, and that could, in theory, move them out of the way? Or another way to think about the recommendations that are the hardest to implement, and so there is a longer lead on that. So there are a couple different ways to think about it. And so I wanted to kind of put that out there. We're a little tight on time. But I guess I'd still just kind of do those, I guess, when you think about the prioritization framework and you think about those 3 questions, do those seem like the right questions? Like the next buckets for us to figure out? I'm seeing nod of heads. And then moving forward, what would it be helpful? So again, looking at recommendations, if they have any that require legislative change, getting that ready, starting at easiest to implement, get them just to move out of the way, and then hardest to implement because it will take more time. I want to leave you some time to noodle on those things. And then we'll plan to pick that back up at our next meeting. And we can have also, and if you have a strong feeling now and you're like, I think we should do it this way, you can email that back in, and then we will discuss this also in the subcommittees. I did want to make sure, just as we were going through, that if you have knowledge and expertise or a recommendation, this is partly your experience, the depth and breadth of your experience. So if you're not in that subcommittee, but you know somebody who would be really great, or you have information that you want to share that would be helpful, please do that. And I just think that I just wanted to make sure that people knew that was an option that was invited and will be helpful. So our next meeting is going to be June 26th from 2 to 4. You should have all gotten the calendar invitation. Please reach out to Chad if you haven't received anything. Goal again is to get materials 48 hours in advance, including our next agenda, and they'll also be posted on the website. So what's going to happen after this is you're going to get a link about the subcommittees, and we're wanting to know what people's interest is. And know that we ask you that, and you could say, well, I do this, but I'm really interested in this, and I have this expertise. That is what we really are interested in. And then we have to take what everybody has and then balance it out and make it make sense. And then the next agenda will include the overview of who is on what subcommittee. We'll have the opportunity to update the prioritization framework. And then people will be off and running in their subcommittees. So I know that people are busy, so I do want to just thank you so much for joining today. I know it's a lot of talking. It's not as interactive. That way it will get more so, but the feedback people have and the ability to really look at these all together and do a deep dive was so important Thank you so much to staff for all of the incredible hard work. And with that, unless there's any, also, folks know how to get a hold of us, and we'll see you at the next meeting. Thank you so much for your time today.
Thank you.